But what about cancer detection? Well, cholangiocarcinoma, bile duct cancer, is very topical and very talked about, not just in the patient forums, but by us clinicians. And we've talked about it quite a lot this, earlier on. Now, a very talented sort of hepatologist from Germany actually said, well, the proteins that cancer cells release are different to the proteins that your bile ducts secrete from PSC and if you're healthy. And you can measure some of these proteins in the urine. And what he's actually been able to do is if you take urine samples from patients who are, who've got PSC, who've got what we call benign bile duct disease, so bile ducts that are sort of damaged for other reasons, and if you've got cholangiocarcinoma, you can detect different spikes in protein in the urine at all. So it may be that rather than just doing all these invasive tests like biopsies and all that, the answers are actually just being released in the urine, and the accuracy of these tests is absolutely phenomenal. And what we are now waiting is for these, because as you can see the numbers here are small, just to prove the point that PSC cholangiocarcinoma in PSC is actually much rarer than we actually thought. If we can prove this in much larger groups of individuals, it may give us the very first sort of non-invasive detection test for cholangiocarcinoma, purely based on a urine sample. And that would be absolutely fantastic. Now, how many of you enjoy annual colonoscopy? I'll tell you one story. So in my very early junior doctor days, there was one patient who, some of you may know, when we say junior doctor, when you're fresh out of medical school, for about the first 10 to 14 years or so, you can't stay in the same hospital. You have to move on every 6 to 12 months. And that's a UK thing. It's not the same everywhere else. But I remember when I attended a colonoscopy list very early on in my career, and there was a patient who came in with just with some abnormal bowel habit, and we did a colonoscopy, it was normal. And when I moved on 6 months later, the same patient came there, and I thought it was a bit strange. And it turned out that he really enjoyed having colonoscopies, and there's nothing wrong with him. So that's why I asked the question. Some people really enjoy them. It's a sadistic sense of pleasure. But anyhow, so many of you don't. I mean, it's not a nice thing to undergo. As I said earlier on, I've undergone one. It's not pleasant. So I have full sympathy for all of you who undergo colonoscopy. How many of you smell your poo?
Yes.
Do you?
Yes.
Do you do?
No.
Yeah. Be careful, Marty may smell some of your. No, I'm just joking. But the reason I say that is there is now good evidence to suggest that certain changes in the scent of poo. So you've maybe heard of sniffer dogs that can smell cancer. So actually, based on that hypothesis, there is now artificial intelligence robots that can actually smell poo for certain organic compounds that are released, and they're pretty accurate at separating out cancer from non-cancer. What we haven't been able to do so far is see whether that signal is different between cancer versus colitis alone.